Hello. Sometimes ECG showing acute inferior ST elevated MI with features of right ventricular infarction. This video is not on the ECG features of right ventricular infarction. I have another video on that. This video is on if the ECG showing the acute inferior ST elevated MI without any definitive sign, ECG sign of RV infarction, then what will you do? Sometimes acute inferior ST elevated MI patients have the RV infarction without ECG features. Then we have to do actually the echo, bedside echo, but it is time consuming. Before echo, we can examine that patient, and by examining by examination of that patient, we can make a clinical diagnosis of RV infarction associated with acute inferior ST elevation. So this video is on what are the clinical features of RV infarction. The number one, patient will be hypotensive. Even patient may be in the state of shock when patient's systolic blood pressure less than 90. And in that case patient's BP may be non-recordable, pulse may be very feeble, and tachycardia, high pulse rate. So this is the number one, the hypotension or in the state of shock. The number two, JVP will be raised, having Kussmaul sign. Okay. Number three, lung beige. Lung beige will be clear, as because the problem with the right ventricle, not with the left ventricle. So lung beige will be very clear. There is no rhonchi or no creps. And number four, liver enlarged, tender. But mind it, enlarged liver is theoretically correct, but in practically enlarged tender liver in RV infection is not found, as because it is a rapid onset. It needs some time to develop enlarged tender liver. So patients having RV infarction have the clinical features of hypotension with these features, raised JVP, clear lung base, and enlarged tender liver. So this is all about RV infarction, clinical sign of RV infarction. Thank you.